My name is Val Brown. I'm the U.S. Sales Director for Stroll.
Hey, George Tomeski is my name. I'm the CEO and co-founder of Helfie AI.
Hey, my name is Ankur Teredesai. I'm the CEO and co-founder of CueZen and also a professor at the University of Washington.
Awesome. My name is Aasim Saeed. I'm the CEO and founder of Amenities Health. I'm also your guest host for today, and I'll get us started. I'll just jump around a little bit. George, I'm curious to hear, you've been at Health for a day or two now. What are the themes you're hearing or the ones that you're most excited about?
I'm most excited by what we're doing.
Tell us about it.
So we make it possible for folk to check 20 or 30 odd health conditions just through their phone. Yeah. So just by coughing into your phone for all respiratory conditions, just by taking a photo around skin for cancers, things like sexually transmitted infections, endometriosis, stroke, all delivered off your phone for a couple of cents. So what excites me about the conversations that are occurring around here is an orientation a bit towards consumers, and consumer health and preventative health, and trying to catch conditions early enough so that people either don't need to go to the health system, or when they do, they're going early enough to have a profound difference in the way treatments impact their conditions. So that's been tremendous from
that's really cool. We're seeing a lot of really cool consumerism. We're in that space as well, and very excited to learn more about what you all are doing just for our own selfish sake, because I think one of the things that we always struggle with is seeing how all the cool stuff at these conferences are all bleeding edge, but then 5 years later, it's not like we're experiencing all of them in our lives. So what's the difference to scale? And maybe, Ankur, you could talk a little bit about like how are you bridging, or how are you seeing people talking about bridging the gap from early innovations that are very promising to things at scale?
That's a great question. When we think about scale in healthcare, and particularly healthcare AI, it can mean a lot of different things. For example, we at CueZen, we do personalization at scale. And if you think about it, for the last 200 years, society and healthcare has been all about standardizing the standard of care across disease conditions. But now with this new era of AI, everyone's talking about personalizing within that standard of care down to a single individual. But when you bring it down to a single individual, medicine has traditionally failed to personalize at that individual level, unless it was your primary care doctor or the nurse practitioner that you really knew about. So how do you bring this empathetic, accurate, enormously beneficial element of personal health to nation scale, literally millions of people? That's where the promise of AI and technology comes in. And what we have built at CueZen is a personalization engine that allows our enterprise B2B customers to then personalize multiple polychronic wellness, fitness solutions to their patient population at literally, as I said, nation scale.
Yes.
And I love the things you're saying about customization and personalizing the healthcare. At Stroll, one of our main features is that the augmented reality technology can be customized for each patient, knowing that each patient's on a little bit different journey with different challenges along the way after an injury or illness. And so we see that it's very, very important for that healthcare provider to be able to continuously challenge that patient in a unique way. For us, we started with the Parkinson's population, and that's a pretty big, wide, diverse population. But inside of that, each has their unique challenges. And we are also very effective in stroke and MS populations. So couldn't agree with you more about customizing the treatments.
So Val, you guys are, I think, pretty unique in the sense that you're also leveraging like very unique and specific Microsoft hardware. Can you just talk about that and what the Pegasus program has meant for you all in terms of the connectivity or the connective tissue to Microsoft?
So we are humbled and inspired to be a part of the Pegasus program. It's been amazing. We've met some incredible people along the way. Microsoft has really opened up a lot of great doors for us. Our technology, our platform, is currently run on the HoloLens, but it's been a great partnership. We have automatically kind of gotten in front of some really the biggest and brightest healthcare systems in the country because of our partnership. And we're just starting. We've only been a part of it for a few months.
Awesome.
Amazing.
Well, and this is, I guess, part of the behind the scenes part where we just talk a little bit about being startups, young and hungry in this type of environment. So, what is the either most exciting or most interesting thing from a startup perspective about growing your company that you guys have been thinking about these last day or two and at Health? This one's a grab bag for anybody. So,
Just the scale of the US market, and looking for traction and capabilities to have a presence here. One of the things that Ankur, you mentioned that I think is really interesting is that we've engineered for scale for the reasons you touched on, not just personalization, but the fact that we are entering an era where 8 billion people can have access to health in a way that's never been contemplated before. And not a whole lot of those conversations are happening too often, and about how do you do that, right? Because healthcare is so insular in some ways, and so we see an alternative system to health. And so some of the challenges for us are, how do you even communicate that? How do you have conversations with people in an incumbent system about another way of looking at not just delivering capability but pricing it, for accessibility and all of those sorts of things. So for a company like us, that's always the challenge. When we say we want to provide preventative health to 8 billion people regularly, because we think that changes the dial in terms of life expectancy in a fundamental way, it's hard to have that conversation because it's like, what? How do you even engineer for that, let alone, think about that and those sorts of things. So, but that's part of the challenge, How do you have a narrative that people can digest and comprehend and kind of buy into at some point? And Microsoft been great for us in that respect, and Pegasus, to echo your thoughts, have been terrific. They get that and they go, wow, that would be amazing if we could help enable that. And that's having us here is part of that.
Yeah.
So we for example, I fully agree with you. You have to simultaneously have a broad vision that has an excitement of a storyline or a narrative that people can attach to very quickly. If it's too complicated or unbelievable, it's hard for either investors or buyers, et cetera, to get excited about. But at the same time, then almost immediately following that comes a very, very gritty question about, great, but how does that work in the US healthcare system? Who do you sell to? How does that make money?
Right.
What is their current version of what you do? And so we, Amenities, for example, we help large healthcare systems modernize both their digital tools, but also, frankly, their entire business model. I mean, health systems haven't changed how they do business in 30 to 50 years at this point, and yet they're competing now with the advent of digital first GLP-1 companies, or specifically advanced primary care models that are saying, hey, a traditional PCP isn't enough. You need a functional medicine doc or an integrative health doc. And so we believe that somebody's got to come help these health systems modernize with both tooling and others. And so all of the things you all are doing are, I think, very interesting pieces of that.
Yeah. So it's spot on about that level of modernization. The biggest hurdles that we see at CueZen is this signal to noise ratio of AI in the market, where everyone's trying to put out some sort of a personalization thing or some sort of an AI model. But CueZen stands out in many ways because we are the only Pegasus startup that is fully transactable on the Microsoft Azure platform. Customers can purchase the CueZen fully functional health coach and deploy it in their own Azure environment. So we are fully distributed from that perspective. And what makes that sort of Microsoft plus CueZen so special and so integrated is this ability of the customer to achieve that level of nation scale personalization that I talked about earlier, without having to get their data to leave their own cloud instances. And so they can feel completely secure and well governed within their regulatory framework in order to then accomplish this health coaching and health nudging and health personalization. So that has been a huge boost and motivation for us in terms of market traction and growth. And we are here at Health really looking forward to the next horizon of digitizing these types of solutions on the Microsoft stack by more going into like an OEM strategy with our customers. So each of you guys, for example, tomorrow, if you look for an AI-based personalized coach to accompany some of the products and the offerings that you are putting out, you could even consider CueZen as one of the potential solutions, right?
Mhm.
So that's kind of our strategy, where we don't have an app of our own, or we don't have a go-to-market like solution, but we go in and embed this layer of personalization.
You know,
Very nice
and-
sell.
Yeah.
You know, it's funny when you say startup, some of the challenges there. I know for us at Stroll, the technology is so unique and so impactful to the patient and the healthcare provider, but yet it's more than selling just bells and whistles and some software. You're also asking the healthcare provider to do something a little different, to change their process along the way and incorporate a new idea. And so you're selling new bells and whistles and new technology, but you're also selling a new concept of a way to treat a patient. And that's an unbelievable challenge, but boy, it's fantastic when you see the results and you see the response from the industry.
I'm curious, is anybody else also transacting through Azure or the marketplace or other things as well?
Yeah, we are.
You
as
guys
well.
are
Yeah.
doing it?
Yeah.
Yeah, I was
So
gonna say.
folk can pick up some of our capabilities through the marketplace and deploy it into their environments, which is what we have at the moment. People using components of our algorithms and checks to specific use cases for their needs, a little bit like what you were describing as a model. But in terms of our core model, though, we are about not so much replumbing the existing system or the efficiencies that are required, because they're enormous, yeah? We're a direct-to-consumer business, so something in the hands of all humans, yeah, that enables them to do the sorts of things I touched on earlier on is kind of where we sit. So yes, we do, transact in that environment, and we do have great customers, but ultimately they serve a means to an end, which is how do we get capability in an end user's hands that solves a health problem in the most cost-effective, efficient way we can.
Yeah, you guys are, I mean, I've seen the capabilities and very intrigued by, like you said, direct-to-consumer element, but it's really interesting to hear that you're still also in the Azure marketplace because, again, I think as young companies, trying to figure out which channel is the right one that scales your business in the appropriate way is the balance. We are in the Azure marketplace, but it's a great connector, and it's a Mac eligibility and co-sell eligible are really kind of unique bonuses. But at the same time, we got to do our direct to consumer, our direct to large business sale, enterprise sale, and then say, hey, by the way, you can use your Mac dollars or the other things.
Yeah,
So
that's where
we're learning. I don't know if this is the right idea.
That's where we're at with Stroll. For us, that'll be a great avenue, a great vehicle for us to expand into a particular health system. You know, if you take any example health system in America, they usually have 8 or 10 or 12 campuses. For Stroll, it'll be a really great way to be able to saturate all of those departments with our technology. And so we're going to count on that marketplace to help us do that for sure.
Yeah, it's interesting. We've been excited about just a lot of the advantages I'm sure we've all had from the Pegasus program of dedicated resources and guidance throughout there. But to your point about being able to transact, is that a lever? I think just recently after the Pegasus program, we also got to meet some of the local sales teams that are associated with their clients in different regions. And it was just interesting to see how embedded they are in various large health systems. So if you haven't yet, just talking to those folks to see who their counterparts are inside of client organizations and what they're structured to do with those folks is just interesting insight.
I agree. It's a huge advantage. I mean, some of their contacts, it would take a while for me to go chase down, and to be able to get those conversations are so much better.
Yeah.
Okay. All right. Well, it was a pleasure having you all. Thank you, Ankur, George, and Val, for joining us and for dealing with my amateur hosting hour.
No, that
Good
great,
conversation.
Aasim. Thanks for hosting us.
All right. Thanks everyone.
Good
Thank
stuff.
you.